talking about how to move these arms specifically, and also move the boom from the field. Sometimes when the nurse is driving the robot in over the patient, you need to move or rotate the boom. She can do it, she or he can do it from the back of the console, but sometimes it's just easier for the people that are scrubbed in to just rotate the boom as the nurse is pushing it in, getting ready to dock it. So we have a button right here on the back of this arm shoulder. I like to call it the shoulder. I like to call this the elbow, and this is kind of like the hand. So if we hit this button and hold it down, we're able to rotate the entire boom itself. Now we have two more buttons that are attached to each of these arms. We have one button here at the bottom of the hand, I like to say, and that's going to move side to side, up and down. And a button up here that's going to angle left, right, forward, and backward. All movement directly from the elbow here. This movement is coming back from the shoulder. I almost forgot one other use for this back button is holding it down and pulling the arm all the way down. You'll notice it's red right here, and that's going to enable the sterile person to lower the boom or heighten the boom, all by the touch of that button. I've got one more button to talk about on this arm. It's located on the back side. Remember, we have our two buttons here, one here, but there's also a button directly on the back side of the arm. And this button is specifically for patient clearance. If after you dock your robot and you have all your instruments in place and the surgeon's moving around and working on the case, and you notice that these arms are getting close to the patient, you can use this patient clearance button to move an arm out of the way to make sure that you have enough clearance so it's not going to be harming the patient. Now what's new with the XI, which is pretty cool, is the fact that you can just grab it and you can move it yourself in all of these directions. I feel like that's a little bit more too much brute force than I'm used to, so I do still use the buttons because it's fine movements and it's easier to dock these arms with fine movements rather than just taking the whole thing and trying to, put it into the trocar this way. It's much, much easier with fine movements with the buttons.